Hello, I'm Ben, and you're watching The PhD Parent. And the most common approach for the treatment of anxiety in kids, and the approach with the most extensive evidence base, is cognitive behavior therapy, or CBT. In this video, I'm going to briefly review the findings from studies that have tested the effectiveness of CBT, plus a couple of other approaches, in reducing anxiety in kids. On a side note, while the research in this area is focused on kids diagnosed with an anxiety disorder, the therapeutic strategies discussed would likely be helpful for kids experiencing high levels of anxiety, but who may not necessarily meet diagnostic criteria for a disorder. So heaps of studies, over 30, have been carried out to determine whether CBT is effective in reducing anxiety in kids. Now, I'm not going to go through each study because there's just too many of them. Instead, I'll discuss papers that have already reviewed the findings. As you'll see, the simple message is that CBT is an effective treatment for reducing anxiety in kids. Before discussing these reviewed papers, it's worth pausing to point out that a general problem with the studies in this area is that researchers have almost always recruited kids with a range of different anxiety disorders. For example, the kids recruited will have been diagnosed with separation anxiety disorder, or generalized anxiety disorder, or social phobia, or panic disorder. And this is a problem because it means that, in principle, if the CBT treatment is shown to reduce anxiety symptoms, then this effect may be carried by positive change only in kids diagnosed with one of the disorders, rather than it being equally effective for all the anxiety disorders. To illustrate, suppose you've got a study in which kids are diagnosed with either separation anxiety disorder or generalized anxiety disorder. And you find that, when considered across all kids, the CBT treatment is effective. Now, this finding would not allow you to say that CBT is effective for separation anxiety disorder and generalized anxiety disorder. This is because, for example, the treatment might have had a whopping big effect for kids with generalized anxiety disorder and no benefit for kids with separation anxiety disorder. But the impact of the former means that, overall, everything looks good. Now, recognizing this possibility, researchers in some studies have analyzed whether the effectiveness of CBT depends upon the type of anxiety disorder a kid has been diagnosed with. These analyses have provided little evidence to suggest that diagnosis makes a difference to outcome. So, while the results I'll discuss come from studies that have involved lumping together kids with different anxiety disorders, and technically you can't really draw conclusions about the effectiveness of CBT for each anxiety disorder treated, there is some basis for taking the results as indicating CBT is effective for each disorder in question. In the following, I'll first look at studies in older kids, those who are 7 years of age plus, and then younger kids who are around 3 to 7 years of age. The main reason for carving things up this way is that in studies with kids aged 7 plus, CBT treatments have mostly been delivered to kids alone. In contrast, in studies with kids younger than 7, the treatments have mainly involved parents and kids. Now, it's worth mentioning that there is a recent meta-analysis by James, which looked at the effectiveness of CBT in kids and adolescents up to the age of 19 years. Because my focus, at least currently, is on kids rather than adolescents, and because James divided participants into age groups in a different way that I'm interested in, that is, they considered two age groups, kids less than 12 years versus kids older than 12 years, I'm not going to consider this review in depth. Nevertheless, if you're interested, James found that compared to kids and adolescents in either a waitlist or no treatment control condition, kids and adolescents who received CBT showed greater reductions in anxiety symptoms at the end of treatment and were less likely to be diagnosed with an anxiety disorder. So onto the effectiveness of CBT for anxiety disorders in kids 7 years and older. So Ishikawa conducted a meta-analysis of studies investigating the effectiveness of CBT in reducing anxiety symptoms in kids 7 years plus. And this meta-analysis looked at 20 studies, collectively involving over 1,250 kids. A few studies had involved recruiting kids a bit younger than 7 years, but the majority involved recruiting kids older than 7 years, and usually up to about 14 years. The results showed that kids who completed CBT did better than kids who received no treatment. For stats people, the Collins D was about 0.7, which is a medium effect size. They also did better than kids who received some other treatment, but the benefit was less pronounced. Again, for stats people, the Collins D was about 0.3, a small effect size. Now, the latter is not overly surprising as it involves comparing two approaches that are both likely to have some positive impact on anxiety symptoms. Ishikawa found that the benefits of CBT were observed whether the outcome was anxiety as reported by kids, parents' reports of the kids' anxiety, or clinicians' ratings of the kids' anxiety. There was a very slight hint that including parents in treatment is better than not, but nothing conclusive. Now, while these are encouraging results, they don't imply that any kid who undergoes CBT is going to see a benefit. For example, in a study by Barrett, about 65% of kids no longer met diagnostic criteria for an anxiety disorder following CBT treatment, but that means that 35% still did. Likewise, in Kendall, about 70% of kids no longer met diagnostic criteria for an anxiety disorder following CBT treatment, meaning that 30% were still clinically anxious. Nevertheless, even those who still met criteria often showed some improvement. For example, when Kendall looked at the severity of anxiety in the 30% of kids who still met diagnostic criteria for an anxiety disorder, there was evidence that their anxiety symptoms were less severe than they were before treatment. So, in summary, CBT is not a miracle cure, and not everyone is going to show a large benefit from treatment. But the general takeaway is that CBT is likely to reduce anxiety symptoms in most kids 7 years and older. So now on to the effectiveness of CBT for anxiety disorders in kids younger than 7 years. I don't know of any researchers having conducted a meta-analysis of studies investigating the effectiveness of CBT in reducing anxiety symptoms in younger kids. COMA have published a systematic review of the literature. In their review, COMA looked at 30 studies across which 2,200 kids plus were recruited. The average age of the kids in these studies ranged from about 4 to 8 years. So COMA found that 6 different types of treatments had been evaluated. Family-based CBT, where parents and child were both involved in treatment. Group-based parent CBT, which is CBT for parents delivered in a group format. Group-based parent CBT plus child CBT, CBT for parents only, and CBT for children only, both delivered in a group. Relaxation training, that was relaxation training just for kids. Play therapy, using play activities to get kids to express how they're feeling, and attachment-based therapy, parents and kids playing together in structured ways designed to improve their relationship with one another. The researchers organized their review according to whether the treatment in question met criteria for one of 5 levels of evidence, which range from well-established treatment to treatment of questionable efficacy. And here is what they found. In terms of well-established treatments, the only approach to meet criteria was family-based CBT. This was because 11 randomized controlled trials, or RCTs, had shown the approach was at least as effective or more effective than an alternative therapy. And 7 RCTs had shown kids who completed family-based CBT did better than a waitlist control. Next was probably effective treatments. Group-based parent CBT and group-based parent CBT plus child CBT both fell into this category. For group-based parent CBT, 1 RCT had shown it was comparable to an existing treatment, and 4 RCTs showed that kids whose parents completed the treatment did better than a waitlist control. For group-based parent CBT plus child CBT, 1 RCT had shown it was comparable to an existing treatment, and 3 RCTs showed that kids who completed treatment did better than a waitlist control. Next was possibly effective treatments. However, none of the treatments considered fell into this category. So then it was on to experimental treatments. Both play therapy and attachment-based therapy fell into this category. Only 1 RCT had looked at play therapy, and this study showed that it had outcomes that were not as good as family-based CBT. No RCTs for attachment-based therapy had been conducted. However, 2 non-randomized trials with no control group had been carried out, and these showed that kids were less shy following treatment. And the final category was treatments of questionable effectiveness, and relaxation training was the only treatment categorized as having questionable effectiveness. And this was because 2 RCTs found that it was not as good as family-based CBT. However, these studies both involved kids with OCD, so doubts about its effectiveness may only be for OCD. So in conclusion, again, the evidence suggests that CBT looks like it's the way to go for treating anxiety in younger kids. And it's probably going to work best if both parents and kids take part together. So that's it for interventions for anxiety disorders in kids. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.